Thank you very much. So I've borrowed the title from the Ella Fitzgerald song rather than the Bananarama song, which apparently may be the same. I've never heard it, but the subtitle will be different. So embedding a wellbeing approach into government. This is some research, or kind of based on research that my colleague Esther Coe and I at the Centre for Policy Development have been working on. And we've got this problem. So let's say you're a government and you've decided that you want to take a wellbeing approach. You want to do things so that all right, well, that'll eventually come up. You want to do things so that the policy decision-making process, the structure that guides what policies get developed, how they get selected, but also a range of other things like procurement or HR policies, tax policies, all these kinds of things are actually going to serve the well-being of people and planet. And you think, okay, what do we need to do first? Let's have a look at what other countries have done. Maybe we can use some of the policy instruments, some of the tools that they've used to help us on our journey to becoming a wellbeing government. And let's say that you think, all right, here's one thing I could do. Cost-benefit analysis, we're doing that, and I want to do wellbeing enriched cost-benefit analysis. And I know that there are a bunch of countries that are doing wellbeing enriched cost-benefit analysis. And I look on their websites and they state that they're doing it. They don't give me a huge amount of information about whether or not that's changing the decision-making process. All right, we'll do that. And the problem is, wellbeing enriched cost-benefit analysis, the UK does it, for example, New Zealand does it. In the UK, it's written into their guide for cost-benefit analysis, their green book. Nobody uses it. We don't even know if it changes outcomes because it's not being inputted into the policy decision-making process from design to selection. It's just anecdotally, it's not being used at all. In New Zealand, CBAX or CBAX, their wellbeing enriched policy analysis tool, is actually being used. And it's being used in a way where there have been independent studies that suggest that the quality of the analysis is better than it was before it had this wellbeing enrichment, and that it's leading to different decisions being made than were being made before they added this wellbeing dimension to their cost-benefit analysis. So now you're thinking, okay, I can't just pick a tool because the tool isn't going to be the thing that changes practice. And we certainly can't get a change in outcomes unless we get a change in government practice. What am I going to do? Well, it's not just what you do, it's the way that you do it. And unfortunately, it's going to be an incredibly tricky process. But what I'm going to do, because God, I would love to speak for 4 hours, but I've got 20 minutes, probably less, I do. I'm going to take you on a little journey to look at one way in which you might start thinking about one of the particular goals that we might associate with wellbeing government. So here's our goal: departments systematically working together to improve well-being with a focus on prevention and early intervention. Great goal, right? I mean, you might even think, isn't that what we're already asking of government departments before we even say that we're going to move into well-being government? Why? Why would it be that they're not doing the thing that we told them was best practice in government, right? And I've got this beautiful Rodney Graham tree. It has been pointed out to me that it didn't actually need to be upside down. But what I'm going to do is start on the trunk of the tree. That's kind of our goal or our central thing that we're working towards. And each step of the way, I'm going to go along a larger branch and then a smaller branch until we get out to the twigs to show you just a tiny bit of that path that you need to take in order to work out what kinds of things you need to put in to change practice, how you need to embed them, what considerations do you need to have, and how is that going to work? So why isn't this being done in the first place? We've got our goal, departments systematically working together to improve well-being, particularly with a focus on prevention and early intervention. Seems like best practice. Why aren't we doing this? There are a whole range of large branches which are going to be challenges to us being able to achieve this, even if we've got great ambitions, great guidelines, great recommendations. And I'm just going to focus on the third big branch, structural changes. These are challenges. Structural challenges are things like what's built into the policy infrastructure, the kinds of hierarchies or divisions that exist within departments, portfolio areas, down to things like what kinds of forms do you need to fill out and where they're going to go and who's going to look out, who's going to read them and how are they going to influence the decision-making process. So one of our structural challenges to departments systematically working together to improve wellbeing and take a prevention and early intervention approach is going to be found in budgets. And we've got a number of ways in which the structure of our current budgets is going to get in the way. I'm going to focus on the third one, the nerdiest one, the inability to factor second round fiscal effects into offsets. Okay, second round fiscal effects. So here's what they are and here's the problem. When you put forward a new policy proposal, when you want funding for this policy proposal, you have to find somewhere that was in the budget where you stop funding something else in order to fund this new thing. When departments say, we would like to fund this new intervention, they have to find money for that new intervention, typically from within their existing budget. So money that was already being spent on existing programs, and often those existing programs will be meeting acute need programs, right? However, when we talk about how to cost these new policy proposals, only the cost of actually implementing the proposal is typically the thing that is accounted for. So you can do business cases where you say, hey, if we do this, it's going to save the government lots of money downstream. But what typically happens is that that might help sell your policy proposal. It is not going to go into the accounting when we're working out how to allocate resources. So to give you one example, we know that if you reduce instances of rough sleeping, demand for emergency department admissions will go down. Rough sleepers are the group that are most likely to not only disproportionately enter emergency departments, but they're also most likely to have longer bed stays in hospitals because they do not have safe places to go when they're ready to leave hospital. And we know that emergency departments and hospital bed stays are incredibly expensive. So here I am, I think, hey, there's this great policy. We take an early intervention approach and we reduce the cost to government. It could be that this is actually much less expensive than you think it's going to be. It could be that it's revenue neutral. Maybe it'll even save the government money. But I can't bank that saving at the moment. In almost every treasury in Australia, and I would imagine most in the world, I can't bank that saving, which means that even if I think this is a great policy that's going to save money, I still have to find room for it in my own budget, which means that I've got to divert funds from existing acute need in order to intervene, to invest in an early intervention, which will actually have better overall wellbeing outcomes and reduce costs further down. But there's just a problem with the way in which we're representing these costs. And I want to just point out that second round fiscal effects is something very specific. This is specifically savings that governments can realise due to reduction in demand for acute services. So often you'll see papers that say, hey, if you do this, there will be billions of dollars of economic benefits. And what they're talking about is things like more people will enter the workforce and so the economy will grow, or productivity numbers will go up, or hopefully, depending on how we're going to tax things in the future, tax revenue will go up. And those might be good things to think about, but actually they're very, very hard to be accurate about. It is very, very hard to tie a direct causal link between a policy intervention and those broader economic effects, because there are going to be lots of things that are affecting them. And so, of course, if you're doing rigorous government accounting, you might think, yeah, we don't want to bank those kinds of effects where we can't be sure that they're going to be achieved. And we can't be sure what their scope is, and we can't be sure how much this intervention contributes to them. But there are plenty of interventions where we can be sure that if we intervene, we will reduce demand for acute government services. And this is something that people have been saying for a long time. And it really surprises me that this is not actually a thing that's being banked. But here is why it relates to our wellbeing goals. Because firstly, this is acting as a disincentive for departments to put forward the kinds of policy proposals that take an early intervention or preventative approach, that actually achieve better wellbeing outcomes and with a future lens. including better fiscal sustainability, which can then be reinvested into meeting greater need, right? But also, it acts as a barrier to departments working together. So if I'm in the health department and I think, hey, there's this thing in social services or there's this thing in transport where they have this lever that could massively affect health outcomes. And we know a huge proportion of the determinants of health are social determinants of health, right? They lie outside of the remit of the health department or the health service. But how am I going to go and tell that other department to invest their money into something where my minister is going to be able to report on those benefits? So even if they're great ideas, great policies, how do we encourage these policies to be developed? How do we encourage these departments to work together? One of the things we do, and it's certainly not the only thing, it's one of those smaller branches coming off one of the bigger branches, is to work out what's the barrier. Partly it's a barrier in this accounting system. And we have this nice example of where a little bit of this barrier has been chipped away. So the Victorian Department of Treasury and Finance, 4 or 5 years ago, started their early intervention investment framework. Roughly or very quickly, it started off almost like a little pot of money, which was only for early intervention initiatives, and early intervention initiatives where you could show that they would represent a second round fiscal saving to not just any government, specifically to the Victorian Department of Treasury and Finance, right? So relatively, if you could get this right, relatively sensible accounting practices. It's like when I put solar panels on my roof and I knew that it was going to cost money in the short term, but we did the calculations and we knew that we would save money over the long term. These kinds of policies. And in Victoria, to close that loop, not just to say here's a fund, obviously a fund will encourage some policies to go forward, right? But it's not going to structurally change the accounting process. To close the loop, they then reinvested those savings back into the fund. So the fund grows every year based on the calculation of how much these interventions are going to contribute to money that is being saved by the Victorian Department of Treasury and Finance. And the fund has been growing more and more, and partly because of what a great job they did, now getting out to like the little sticks at the end of the branches, in embedding it in an appropriate way. So here are a few things that they did. Firstly, they knew that they needed to build a network of linked data, partly in order to make sure that they could be very, very certain that they were going to achieve these fiscal savings. You want rigorous, effective accounting, and you want to make sure that this works so that it can continue over time and that it's not being politicized, right? So it's not just about giving people more money for social projects or whatever. This is just about rigorous accounting. So that was not an easy task. The data was actually there. They had to work with over 60 data custodians to get the permissions and authorities to link this data so that they could have this kind of rigorous accounting. They also built in a buffer so that they are only banking 50% the projected savings, not 100%, which meant that if their calculations weren't exactly right, that wouldn't cause serious problems to the budget bottom line going on. One of the nice things about this approach is they're getting it right. Only one budget bid that has entered EIF has not achieved the savings that they predicted that it would save in terms of the reduction in demand for acute government services. And in addition, these budget bids have a much higher evidentiary standard than any other budget bid, both in terms of the selection process, but also because they don't set and forget. So this is something that blows my mind. Did you know that actually government departments rarely, I mean, a lot of you will be from government departments, you probably already know this. Government departments rarely go back and actually check what's going on with the initiatives that they funded, whether or not they're costing the amount that they thought, whether or not they're achieving the amount, the outcomes that they anticipated that they were going to achieve. Now here, they have to go back every year to make sure that they're achieving those fiscal outcomes because that money has already been pre-banked, right? So it provides an incentive not just for investing in the right things, but having the kind of rigorous decision-making, this kind of rigorous evidence base that we've been asking of governments for a very long period of time, and I can imagine a lot of people thought was already going on within government. Here's another thing, so they invested in a, they invested in a homelessness reduction program through the Early Intervention Investment Framework using this model, and it's quite a long, detailed, it has 7 years of wraparound services. So far, what they've found with this homelessness rough sleeping intervention program is a 90% reduction in rough sleeping amongst participants and a 60% reduction in hospital bed stays amongst participants. They've actually saved more money already than they've been spending on this program. That has enabled them to scale up. Right? So you say, oh, this program's working, what now? Well, they have the evidence that has allowed them now twice to scale up this program and to avoid some of the maybe contentious political battles that you might have trying to get really good policies that improve well-being, but that might be politically tricky as well. But here's the other thing. They were aware that they needed to overcome a lot of barriers to cultural change, right? It's hard to change the way in which people act. We go back to business as usual. One of them was overcoming barriers to participation. So line agencies typically don't have the capability or capacity to do the kinds of accounting that you would need in order to show that they're going to have this saving, particularly the really, really rigorous accounting that you need in order to make the case that you're going to get this saving that's then going to be banked into the budget bottom line. So DTF said, all you need to do when you're putting something into the Early Intervention Investment Framework is give us our usual policy proposal plus an extra spreadsheet. You tell us what are the evidence-based outcomes that you believe are going to be achieved and what's the evidence for them, and we will work out how much that's actually going to save us. Now, it feels like a lot of extra work, but they were going to have to run those numbers anyway, right? That was part of the calculation. It was a lot less extra work than they'd anticipated, and they have done this for nearly every budget bid over the first couple of years of this project. There was the odd department that actually had really good capabilities. So, often those transport, infrastructure, the ones that we don't typically think of as, wellbeing related, but actually have huge numbers of wellbeing levers. They were quite good at this, but DTF worked with these other departments. They built up an incredibly strong working relationship. People now know that this works. They can see that the fund is being expanded. They can see it's worth their time, and it's beginning to change the kind of data that they're looking to collect. It's beginning to change the kinds of bids that they're thinking about. It's beginning to change practices like working together with different departments, because DTF can now pair them together, make recommendations about how they could have joint bids. And now they're also building capacity within these departments, because the departments, the line agencies, are much more willing to invest in this building capacity. Now they know that it actually works. So there was a bit of hand-holding, but without those kinds of cultural change, looking at the real details, very clever, but very detail-focused cultural change interventions, it's likely that it wouldn't have worked. Well, okay. However, so we've done our little twigs at the end of the branches, and now I'm going to take a couple of steps back. Here's the challenge, right? This is just one piece of the puzzle. So you can do this all the way down. EAF is fantastic, but you want to think about what the next steps are. EAF is not sufficient on its own. So expansion is going to need a coordinating top-down framework, because at the moment you've got fantastic but often piecemeal policy proposals going to the program. If you've got strategies to alleviate wellbeing deficits in particular areas, to work towards particular, agreed upon wellbeing goals, then that can make sure that you're actually joining all these departments up, all the work, all the need, so that you're getting targeted the right kinds of policy proposals going through this process. So essentially they need a top-down wellbeing framework. Cohesive, holistic decision-making needs a way of banking second round costs, not just benefits. This is great to incentivize departments for coming up with things that are going to save money by reducing acute demand. Acute demand's quite a nice shorthand for wellbeing deficits. But it's not great yet at stopping departments, or making them at least think about the real costs of policy interventions that we know are going to have significant second-run costs, whether they're health costs or environmental costs. And it's really important to represent those costs as a way of making sure that they're accurately factored into decision-making. That things could be much more expensive than they're presented as being if you don't factor in the kind of environmental or health damage, for example, that they're going to cause. There's a question about how we go further upstream. It's focused on early intervention, but how do we get to the root causes of those problems? There's a role for data collection, sharing, and modelling. One of the challenges is obviously environmental data, and that kind of causal environmental data. It's much harder to capture for this kind of accounting modelling. That's something they're working on. And accounting and budgets can be a catalyst for change, but deeper systems change is also going to require supporting practices. It's going to require all those other branches. I'm going to take one more minute, just literally read through this because hopefully it'll be helpful. And this is kind of the summary of some of the key findings of our research in a report that will be out, I'm going to say August. Here are some key lessons. Barriers and opportunities already exist in the system. You can't make recommendations or tell government departments, agencies to act differently without recognizing that there might be things that are already there that are going to prevent them from being able to, or disincentivize them from being able to act on your advice. It's hard to achieve change without making it required or desirable. Obviously, it was great that EAF had this incentive built into it. We have seen that it's much more successful when you've got carrots or sticks, or when you've got the right kind of hand-holding, which I don't have time to go into. Wellbeing frameworks may require many component parts which mutually support each other, top down and bottom up. They're most effective when the same lens is taken to everything that you do. Evidence and data is important, but you must have a plan that directly ties these to the rest of the policy process. So this wasn't just, there are lots of cases where you can have huge amounts of fantastic data amassed, but if there isn't a plan for what to do with it, if it's not part of the decision-making process, if your file on why this is a good policy proposal gets bigger but no one reads it, then there's more work to be done. And at heart, most of embedding a wellbeing framework is a cultural change process. So you can't overlook the importance of little things in social norms. Thank you.